Good morning, Social Epi students of 2014, both those of you who are committed and those who are questioning. I am Lisa Bates, the instructor for the course, and I'm very sorry that I'm not here with you this morning. I am regrettably away overseas for an investigators meeting for a grant project that was really poorly timed but unavoidable. So I'm producing this mini overview of the course by digital means so that I can be sort of virtually with you today. And then I'm leaving you in the hands of your two very, very capable TAs, John Pamplin and Carolyn Bancroft, who will be facilitating today's session and also answering any questions that you might have about the course. So for those of you who haven't met me before, encountered me in the core, just very briefly by way of introduction, I am a social epidemiologist by training. I trained at the Harvard School of Public Health with many of the sort of leaders of the contemporary social epidemiology period, people like Lisa Berkman, Nancy Krieger, and Ichiro Kawachi, many of whom will be reading over the course of the semester. And I've been on the faculty here now for several years after joining Columbia as a Health and Society scholar with the RWJ Foundation. And the focus of my work, beyond just being an instructor of social epidemiology, is looking at different axes of social inequality related to things like gender, race, and immigration, both in the US and overseas. And the project I'm away to meet on right now is something happening in Pakistan that is focused on maternal depression during pregnancy and outcomes among infants born to these women, and looking at an intervention to mitigate depression, and also looking to understand some of the gender and poverty dynamics that might be giving rise to both the increase in depression during pregnancy and the ability of an intervention to mitigate it. I do also work in rural Bangladesh, focused on gender-based violence and mental health outcomes. And in the US, I'm focusing on different aspects of racialized social stratification and health outcomes. I'll let John and Carolyn introduce themselves. As you can see here, we have two TAs, but they're also a little bit split in terms of their roles. For those of you who don't know, we have an online section of this course this year. This is something new to allow students who are either away for their global health practicum or elsewhere and unable to be physically present, are going to be, on a trial basis, in participating with us. Hello to you all watching this from your respective countries, in an online cohort. And Carolyn's going to take the lead role in facilitating that group's experience of the course. And John is the primary TA for the bricks and mortar version of the in-class version of the course, but Carolyn will be with us for several of the meetings, and they'll be working closely together on all aspects of the course throughout. So what we'll be doing today, by way of an agenda, I'm going to, in this format, give you an overview of the course, its content and requirements, and allow then John and Carolyn to give you some filler, also answer any questions you might have about what's discussed here. Then that will be followed by a very mini lecture that's really just covering a few key points, kind of anchoring around social epidemiology. Where did it come from? What is it? And so forth, much of which will touch on or overlap with the readings for today. Then you'll have a chance to introduce yourselves. Unfortunately, I won't be there, but through the student information sheet, I'll have a chance to get to know you that way before we meet next week. And then John and Carolyn will give you an orientation to the Canvas course management system we'll be using instead of CourseWorks for the course. It's pretty intuitive. I've never really had a problem having students navigate this before, but just to give you a little bit of a head start, they're going to go over some of the key features of the course management platform that you'll need for the course. And then I'll have you watch the first segment of the documentary series on natural causes, which is getting a little bit old, but I think still covers a lot of the core material, principles, concepts, and empirical evidence that we'll be dealing with in the course. This first segment's an hour long, and it does give you a nice overview of a lot of different dimensions that we'll be covering, as well as covered in other segments of the documentary series. And if there's time permitting after that, then you'll be able to have some discussion there. So let me get started with an overview of the course. The objectives of the course, broadly speaking, are to establish the parameters of social epidemiology and locate it within the broader discipline of epidemiology, to learn major theoretical and conceptual approaches, to review empirical evidence regarding key social determinants of health, and to do so quite critically. In many cases, you'll be assigned readings that are flawed and or severely limited in some important way, and our job will be to critically analyze that empirical study in terms of its methodology, as well as in terms of its author's conclusions around the evidence they have generated. And throughout, we'll be discussing methodological challenges and future directions in the field. The focus is very much on social determinants of health from the perspective of social epidemiology as a subdiscipline of epidemiology. This is not a medical sociology course. We're not really talking about the social construction of disease states, for example. We're really looking at this as a course in epidemiology that attempts to use social theory and social phenomena and identify the ways in which we can extract from that knowledge of sociological insight and so forth, ways of studying social experience and how it is impacting health. So we'll really be using sort of the causal frameworks, causal thinking approaches, and methods of epidemiology to try to understand how these really complex social phenomena influence people's health. The emphasis on the material we'll be reading and discussing is on research, but we'll be extracting from that and extending that to the implications for policy practice and advocacy throughout. And I do this unapologetically, even though I know that students, particularly master's students who aren't necessarily headed on a research track, feel justifiably a need to have some concrete skills and understand how, that may not have to do with research, and understand how what they're learning in the course really applies directly to the kinds of professional experience they may be having when they graduate. And while we will address that and speak again to how the research, the evidence base relates to and has implications for practice, et cetera, and policy, we need to be very, very firmly anchored in the research. And the goal here is that that is what you get out of the course, and that you, even if you don't go on to be producers of research, you're going to be really savvy consumers of research and also citers, C-I-T-E-R-S, of research. In other words, an important, often overlooked professional skill, concrete skill, that you can leave here with is the ability to draw on and reference that research base judiciously and in a time-sensitive manner and with great accuracy, and also with a critical perspective. And so there will be some emphasis here over the course of the semester on you knowing key people, key studies, key theories, etc., so that these can be things available at your fingertips when you leave to deploy as relevant. The topical areas we'll be covering can be divided into these various themes. Today is just a background, stage setting, intro session. Then we're going to start a series of discussions of different axes of stratification and inequality. The next two sessions will focus on class and socioeconomic status, and then we'll come back shortly later to focus on race, and then immigration and ethnicity, gender, and sexual orientation. And lo and behold, for those of you who went through the core curriculum last year, this probably looks a little bit familiar, and you might be bemoaning that. I bemoan this. I've never liked this approach of creating this kind of catalog of inequality or catalog of difference or stratification. And there is some overlap with how we did it organizationally in the core. I can promise you that, and as a side note, for those of you in the room who didn't go through the core, if you ask your fellow classmates what that is, they can give you an earful, I'm sure. But in short, it's the core curriculum for incoming first-year master's students at MSPH now. And the part of that is a 6-session, module on social determinants of health, where we cover much of this material on stratification inequality. What we will do here in this course will obviously go much broader and much deeper, be much more critical. We'll cover a lot more material, and we'll engage it very, very differently. There will be lectures, of course, but really the task here is that we engage in it collectively. We have a lot more opportunity for discussion and going very, really deep into the ideas, the literature, very particular specific studies, and so forth. So I can promise you that there won't be too much redundancy, And part of the maintaining this organizational crutch for the moment is just that things continue to be in flux with the core, and we're constantly having to recalibrate each year after that. And until the dust really settles, I'm not going to do anything wild and crazy and innovative, which, for example, might look like organizing these around the ways in which they intersect and have cross-cutting features to them and so forth, which would be preferable intellectually in a lot of ways. Okay, enough apology about that. The next theme we'll be covering is sort of, and this will be in many ways a cross-cutting theme, but we'll have a whole session focused on processes and pathways. That's the fourth module, and there we'll be talking about both life course issues around temporality of exposures, both their chronicity, the acuteness, the timing over the life course, and also primary physiological mechanisms hypothesized to explain how the social conditions that people encounter get under their skin. Some of that will be touched on today in the video segment. We'll then move on to some social exposures we didn't get to even touch on in the core, focused on social ties, connectedness, network, social capital, things like that. Also, neighborhood exposures, place, features of the social environment and physical environment that affect health, and employment as a site where often social exposures are particularly salient. And then finally, with the last two sessions, we'll have a module focused on interventions and inference, causal inference specifically, and then a final wrap-up and future directions in social epi session. We'll also be engaging a number of cross-cutting themes throughout the semester, and I want to emphasize this because this is what gets us away from that regrettable kind of catalog of difference or inequality. One of them is methodological. Throughout, we're really going to engage with measurement issues. This is one of the biggest challenges in all of epidemiology, but maybe particularly pronounced in social epidemiology. And often when people say, well, I want more methods, or can you give me more methods, or what are the methods of social epidemiology? Often what you're talking about is measurement, is how you take these big, complex, messy, fat social constructs and you reduce them, and that's what it is. It's a reductive exercise for the purpose of quantitative research. And you figure out how we can study them empirically using quantitative methods, the methods of epidemiology, in a population health study. And so we lose a lot of the nuance, we lose a lot of the complexity. We do so knowingly, and then we use that knowledge to temper our interpretations, ideally. But it's still a real challenge to get there in the first place. And that is also the motivation for one of the core assignments that you'll be asked to complete as part of the course. The other cross-cutting theme related to methods is causal inference. Again, this is not specific to social epidemiology at all. We'll talk about some of the ways it's unique to social epidemiology. We'll talk about causal inference from kind of two perspectives, and sometimes these come as two camps. Although I don't think they're as mutually exclusive as sometimes people make them out to be. One is a causal inference approach that focuses on really understanding mechanisms and developing a story using perhaps triangulated data sources, different populations and so forth, that really over time and over a body of literature really makes a compelling story about a causal process that's underway and demonstrated in the research. The other is to get really good at precise study design and estimation. And sometimes this approach, which might have a perfect effect estimate that is perceived to be completely free of bias in some way, and we don't know why it seems to be significant, but it seems to be really robust because we've addressed all sorts of threats to validity. And then we get very invested in that very specific effect estimate. And yet we don't really have a story that goes along with it, like why it would be so influential on some health outcome. The next cross-cutting theme is that we'll be engaging with theory throughout. We'll attempt to do this in a number of ways. It won't be this is not a heavy theory course, but we are going to spend some time talking about the importance of theory for epidemiology, something which many people have not always agreed with. And we'll also draw on theory throughout as a way of anchoring what we're empirically estimating in what is understood theoretically about the social phenomena under consideration.